Well, today starts National Suicide Prevention Week, and coming up next on the morning show, we're going to hear from a specialist about how you can help try and prevent teen suicide. Our students from elementary school to college deal with a variety of pressure from all kinds of different sources. But what happens when a child or a young adult is pushed too far? On average in the U.S., every 2 hours of every day, a teen ends his or her life. Now, with today marking the first day of National Suicide Prevention Week, we have Melissa Witmeier, a project coordinator of Daniel's Florida Youth Suicide Prevention Project, here to talk about the problem of adolescent suicides and how it affects our community. Did I get your last name right?
Witmeier.
Witmeier, okay.
That's okay.
You know, suicide's still really much a taboo in our society. Is that part of the problem?
It is. Teen suicide and suicide in general, it's a public health concern, but we're not talking about it. It's something that we need to start talking about in order to help make this situation better for our community. So in 2009, Duval County received a grant, the Adolescent Suicide Prevention Project grant, and we began to train gatekeepers in our community to identify people who worked with adolescents. We've now expanded the grant to be in St. Johns, Clay, and Nassau counties. So we're working all over the area trying to help people be able to look for the warning signs, know what to do, and then to help link our youth to resources.
Your notes here, in 2011, a study in Duval County found that 1 in 5 high school students thought about suicide. And then those are just the ones being honest in this study.
Correct.
1 in 9 made an attempt of suicide. That's terrifying.
It is. And when we are in the schools talking to students, we see these numbers. We see the kids that are identifying and saying, I just need somebody to talk to. Again, people don't talk about suicide. So it's important to begin to talk about it. So when we identify youths that are thinking about it or attempting, we really need to begin to look for a few things, the risk factors and warning signs. That is, first and foremost, when people begin to feel like they're a burden, that's really a sign that they just don't feel like there's a lot going on in their life.
Will they verbalize that?
They can. We can hear people saying things like, I just don't want to go on anymore. I just want to go to sleep and never wake up again. Or the very direct statements of, I just want to kill myself. We also look at when people are isolated, alienated, that social connectedness is so important. When people have resources and a safety net, they have a way to keep themselves safe. And then the last part of it is if they're engaging in risky behavior, if we're seeing things that they're doing that really cause them to be put in danger.
Now, these are what you'd consider red flags. I mean, look, risky behavior, a lot of kids do that. I mean, that doesn't necessarily mean they're suicidal.
Correct. But we're also looking at changes over time. If we're seeing that our youth are changing, things are happening, and they're not quite the same as they used to be, a red flag needs to go off. We need to begin to talk about it. And that's a key for parents, is when you see these things, let the kids know that you're willing to talk and listen to them. That's the first step. If we talk about it, it makes people feel better.
It's one thing to recognize the red flags, but what do you do if you're a parent or if you're a teacher or if you're a guardian, anything? What do you do if you...
So there's a couple things. One, talk about it. 2, get professional help. It's very important that we link people to resources in our community. Agencies like Daniel that have counselors and programs for kids to be able to feel better. It's also then important to link the youth to other resources. You can call the Lifeline number, which is...
we're going to put that up on the screen here, the hotline.
It's 1-800-SUICIDE or 1-800-273-TALK. It's a 24-hour crisis hotline that anybody can call. If you're worried about somebody, you can call and process that with them. Or you can, if you're at risk, call the number and talk to a hotline counselor about what you're feeling and what's going on in your life. So you do have somebody who's listening. That's very important. And then just... again, letting that person be able, for the first time probably, be able to talk about what's going on.
The hotline again is 1-800-273-TALK, which is, well, I don't have TALK written out, but 273-TALK on your phone number, or your phone. All right, thank you, Melissa, for the information. Good information this morning.
Thanks.
If you're interested in learning more about suicide prevention or attending a candlelight vigil, which is this Friday, which we didn't get to discuss, go to news4jax.com or danielkids.org for all the information there. Thank you.